Okay, thank you guys for joining us, and we will go ahead and get started. Today is our community of practice, so I'm going to go over the meeting guidelines. Please stay muted when you're not speaking to reduce the minimize the background noise. We want you to use the raise your hand feature if you have any questions, if you'd like to speak. And if you are like me, want to fly below the radar, you can use the Q&A link and submit your question through the chat. Next slide, please. If you can scan the QR code and let us know what LEA you are attending for, we'd greatly appreciate that. And I know Karen also put the link in the chat. Next slide. Okay. All right. So I do want to take a minute to thank everybody for submitting their progress reports. We almost had 100% compliance with DHCS, but we missed it by one LEA. But we really, really appreciate you guys tolerating our phone calls and emails and reaching out to see if what we can do to help support you to get those submitted and into Qualtrics by the deadline. Next slide, please. So because you have submitted your second progress report, we are still complying with the MOU, and you can submit your final capacity grant invoice for your last 10% to us. So you can send it to the SLP capacity grant email, or you can email it directly to your specialist, and we will get it to accounts payable as soon as we get the money from DHCS. So we haven't received the 10%, but we should be getting the 10% because we also submitted our progress report. So they're holding everyone a little bit accountable. So as long as we've received your second progress report, please submit your invoice so that we can work on getting that money transferred to your account. Or I know a lot of our charters, we have to actually mail paper warrants to. I also just want to remind everybody that SBCSS is available to provide, technical assistance, and it can be outside of the capacity grant, questions. We have a whole healthy SBCSS department that works on a lot of different specialties. We have TUPE, we have the suicide assist team, we have our CalFresh team. We work with community schools. So if there are any needs, any assistance that we can provide, please reach out. We would be happy and delighted to assist you. I also would like to let everyone know that the electronic health record vendor Healthy Campus is still available. If you are interested in using their platform, please reach out to me and or the specialist so that we can put Healthy Campus in touch with you all. Next slide, please. So HCI is actually seeking feedback about the wellness coach experience and the wellness coach pathway. So if your LEA is using certified wellness coaches, we would love to know which ones are so that we can share your information, because there are some districts and LEAs that are trying to leverage certified wellness coaches. I know I can pick on Karen, who has become a certified wellness coach, and I know she has some direct contacts within DHCS that can also assist with that. I know she works with, what's the Desert Mountain School? Not RIM.
Snowline.
Snowline has a very rich wellness coach program. So HCI is really looking for feedback, and if you are willing to participate and give them some feedback, please let us know so that we can provide you with that link. And they also have a certified wellness coach webinar coming up on Thursday, February 19th from 3:30 to 5:30. And we can also make sure that you have that link if you are interested in participating in that webinar. Thank you. Next slide, please. All right. So I have to fill in for our LEC 10 coordinator, Rebecca, who is out unexpectedly today. And with me will be, well, I'm going to really give Elizabeth Plaster from Silver Valley all the kudos because she has been supporting ESMA and LEA Bob for many, many, many years. She's currently at Silver Valley as the Student Health and Wellness Specialist, and she too is working on becoming a community health worker so she can support the work being done in CYBHI for Silver Valley. So I am going to turn it over to Elizabeth, and she's going to go through these slides. And if you guys have any questions, like I said, please use the raise your hand feature, and we will answer your questions.
Thank you, Veronica. All righty. So next slide, please. So for small and LEA BOP, California has 11 different regions that oversee these programs. We are Region 10, and that is a team of 6 people that oversee small, RMTS, and LEA BOP for that region. That consists of Rebecca Smith and her team. Now, they did change the name. It's not going to be the LEC anymore. It's now going to be considered the RMTS Administrative Unit or RMTS Unit. So if you hear both of those terms, just know that they mean the same thing. Excuse me. The Region 10 oversight counties covered is San Bernardino, Riverside, and Yomono. And to participate in small or LEA BOP, you must contract with Region 10 LEC. However, there is a caveat to that. If your district participates in LEA BOP, but is using exclusively contracted employees, you will not contract with the LEC. You would be considered a Model 2 district, and you would work directly with DHCS. But if you want to participate in SMA, then you would contract with the LEC. And it does bring out that we have over 70 districts, charters, and community colleges that are participating at this time. Next slide, please. Alrighty, so this is a beautiful little slideshow, and it has this graph on here that basically breaks down what SMA and LEA BOP are. It all starts with CMS at the top. That's the Centers for Medicaid, Medicare, and Medicaid Services. And they oversee DHCS, which is the Department of Healthcare Services. DHCS then oversees both programs of SMA and LEA BOP. Now, SMA, underneath them is your LEC, or the administrative unit, RMTS unit. And then you have the LEA. And LEA BOP, you go straight to the LEA, but both programs use RMTS in order to get percentages, in order to make the invoice or the CRCS for each program respectively. But an easy way to remember who does what, CMS makes the rules, DHCS enforces the rules, the LEC administers the rules, and the LEA follows the rules. So if you think of it as a order of just a order of operations, it'll be easier to keep track of who belongs where in this program of things. All right, next slide, please. All right, does your district participate in SMA, LEA BOP, and CYBHI? Do you know if your district participates in small LEA BOP or CYBHI. These are things you should know. And even though you may not be in all of them, you might be in one, but you may have a coworker that is in another, but you're still all under the same district. So you need to know these things. Next, please. And now the question, who is your district coordinator for small LEA BOP and CYBHI? Fortunately for me, I know all three here at Silver Valley because they're me. This may not be the case with all districts. Lots of districts separate these job duties into different positions. So you may be doing small, and somewhere else in the district they're doing LEA BOP, and somewhere else they're doing CYBHI. But you want to work together in this program. It's something that coming into it, you don't want to have the attitude that you can do it all by yourself. If you're a coordinator for any or all of these programs, you need to know that this is not a job that is a one-person job. You'll need to develop those internal relationships with those in your district, different departments to run successfully in each program. And even if you aren't in all three, you should know what the other programs are, who the coordinators are, and the basics of the program itself. And by doing that, it'll help you to do your job more effectively because you know that others are doing theirs effectively as well. Okay, next slide, please. All right, what about reimbursement? So for SMAW, the LEC would process these small invoices quarterly, so that's 4 times a year. The first warrant can take up to 18 months after joining to receive. So it is a little bit of a wait when you first get started, and then on a quarterly basis, you would be receiving this income. For LEA BOP, billing would happen on a routine basis. As much as you do, as much as you turn in, that's as much as you're going to be getting back. Money comes in much quicker and more often, and this can usually get the district moving faster than participating in just small alone. So the LEC would receive small funding and they give it directly to the district. And funds from LEA BOP come directly from DHCS to the district. So it's just a way of filtering it down. So it's still coming from DHCS, but for small, it goes to the LEC first, who processes it, and then it gets sent to you as a district. How how reimbursement funds are used varies by the districts. The LEA BOP requires a committee to determine fund use. That collaborative is made up of different members with genuine interest in your district. There is guidelines for who should be a collaborative member. And for small, while it doesn't require a collaborative or a committee, some districts may choose to form one. And then if they don't form one, then the district may opt to have those funds deposited into the district's general funds, just as a way of distributing the money. And next slide, please. So for reimbursement, you want to be participating in all 3 programs. Oh, I lost my page. Okay. So for these programs, you need to understand that for SMAW and CYBHI, the funds are unrestricted. That means that you can use the money recovered for anything you deem necessary. LEA BOP funds are restricted, so you need to be careful on what those are being used for. You want to make sure that you have a relationship with your accounting team, fiscal services, business department, whoever receives the money in your district. Make sure that they are aware that these funds are coming in and that they're kept in separate accounts so as not to go against compliance for the LEA BOP restricted funds. One way to think of it is that small handles the administrative tasks. It can recoup costs for health-related outreach and coordinating referrals for students to community providers. The LEA BOP is the direct medical services, helping to offset the high cost of specialized staff salaries. And CYBHI is the behavioral health from multiple payers. It can fund brief interventions, screenings, and early intervention therapy that were previously unfunded. So by using all three of these programs, your LEA can provide a no-cost beneficial program for health to families. So it really is, even though these programs are optional, it really is beneficial to not just for us as a district to maximize our reimbursement, but also for the students as well and the families to be sure that they're getting that well-rounded health care even when they are at school. Next slide, please. Okay, so fees that you would need to think of. Excuse me. When you are getting started, one thing to remember is everything costs something. So you need to count the cost before you start spending the money. You need to make sure that you know what you're getting into before you jump all the way in. So there will be a LEC fee that is collected annually. And then you have the staff that you are going to need to designate to run the program at your district. Does this mean you're hiring new staff or does this mean you're utilizing existing staff? That's something that needs to be considered. Number three, a third-party vendor fee for any or all of the three programs. If you use a vendor for one, are you using them for multiple? Again, these are conversations that need to be had internally with administrators that have the power to affect change and understand the program as well. Number four is you don't want to forget that you're going to need an EHR or an electronic health record. Either way, if you're participating in LEA BOP or CYBHI. Now, we use a vendor for small LEA BOP and CYBHI. We use the same vendor. And the vendor actually has their own EHR. So we don't have to do steps 3 and 4 because 3 and 4 are combined together. So that's another way you can offset costs is if your vendor already has that on platform for collecting health records electronically. Next slide, please. Alrighty. How to participate. Oops, I'm on the wrong one. So for participation, for SMA, you need to be providing Medi-Cal outreach. This is done on a regular basis and it's consistent amongst those that are participating in SMA. This would be part of their regular activities. They would be providing efforts to identify and enroll eligible students in Medi-Cal. For many students, if they're not insured, they could be insured by Medi-Cal. So by having those conversations with those that come into health offices, come into the school site offices, this is one way that you can find out, are they in need of Medi-Cal? And then you providing that contributes to your small funding. And then you have LEA BOP. You need to be providing allowable direct services to Medi-Cal eligible students that have IEPs, care plans, IFSPs, or etc. Now, I wrote down, because I knew I was going to forget, in case you're wondering what all these acronyms mean, IHSP, Individualized Health and Support Plan, IFSP, Individualized Family Service Plan, or IEP, Individualized Education Plan. So those are just some things to consider, that you would be providing these direct services for those programs. And then CYBHI, you would be providing allowable direct services for all students, not just Medi-Cal eligible. And CYBHI does stand for Children and Youth Behavioral Health Initiative. So that's where you would be collecting those funds if it is falling under behavioral health. And you want to be understanding each program requirements and making sure that your district qualifies for these programs before joining. You want to find out if you can currently perform these activities, or if you will be able to perform them by the time you join. If it seems that maybe you don't do any of these things, maybe these aren't the programs for you. We assure you that someone is doing these things in your district. So it's just a matter of ensuring that you understand that these things are taking place and how to manage them. You want to make sure that your district is properly staffed before joining the program. Like I said earlier, it could be either hiring new staff or utilizing existing staff, but you have to have someone designated as the coordinator, and they need enough time in their workday to be responsible for everything needed from the LEC, from DHCS, and from your vendor. You think of it as the coordinator is the central hub for all things, everything. They're the ones where the information comes through first and then it gets distributed to who it needs to go to. Your coordinator is a very significant role in the programs that you run. Next slide, please. Alrighty, so these beautiful graphs or picture diagrams, whatever you want to call them, they bring out the different programs and what is entailed in them. The CYBHI fee schedule, again, this is behavioral health, so you have mental health assessments and screenings that are not pursuant to an IEP or IFSP. Psychotherapy, not pursuant to IEP FSP. Psychoeducation, not pursuant to IEP IFSP. And case management, not pursuant to IEP IFSP. You can sense a theme going on there. If they have an IEP or an IFSP, they are not qualified for the CYBHI program. However, they can have an IEP for speech, but they're receiving mental health services under CYBHI. That is allowable. So you just need to work with your providers and making sure that you know what's in their IEP. Are they receiving, does their IEP state that they're supposed to be receiving mental health services? That would disallow CYBHI. Or if their IEP is for something else, like speech, then that would allow CYBHI services. Next one over, we have LEA BOP covered services. This is those direct medical services that are provided to students. So you have IEP and IFSP assessments, you have treatments, targeted case management, and specialized medical transportation. And then under IHSP, you have the non-IEP, IFSP assessments, treatments, and targeted case management. So these ones really fall under different positions, like psychologists is a good example. They would be performing assessments and treatments and targeted case management, and that would be a daily part of their job. For SMA, the one on the bottom, school-based Medi-Cal administrative activities. So you have transportation for Medi-Cal services, translation for Medi-Cal services, program planning, Medi-Cal outreach, Medi-Cal application, and then referral, coordination, and monitoring of Medi-Cal services. So the small aspect is really the admin side of these services. So you have SMA as admin, LEA BOP as direct, and CYBHI as behavioral health. I know that's a lot, but believe me, in time, it gets easier to distinguish the three. Um, but you have to give yourself time and you have to give yourself a little bit of grace. Um, Understanding that you're not going to get it the very first time around is actually very helpful because it can be very stressful trying to manage all three programs when you're not really sure what the first program was. I would recommend going to the DHCS website that Karen just dropped in the link in the chat, excuse me. And DHCS has a website for each of these programs, a separate website for each program. And they have resources on there, manuals, onboarding handbooks. Everything you could need to get started with these programs would be on the DHCS websites. So I highly encourage taking a look at those and saving them to your bookmark bar. Next slide, please.
Okay. You can advance, but I just wanted to say many LEAs are participating in one, but we want to let you all know that these three fee schedules are available for all LEAs to participate in. So if there's an interest in someone who said no to SMA to now participate in SMA, please let us know so that we can get you connected. I know if Rebecca has the layout of all the LEAs that are participating, all the districts that are participating, and she is willing to collaborate and work with you to onboard you to ESMA and LEA Bob. And our behavioral health team is here to help you guys with CYBHI fee schedule. All right. Go ahead, Elizabeth.
Yeah, so while they are not you're not obligated to participate in all three, it is highly encouraged that you do so. Um, who can participate in SMA and LEA BOP? We have district employees and contractors. Each employee can participate in one, two, or all three programs. The district would determine how to move forward and makes final participation decisions. It's the district's responsibility to assess qualifications and assign employees appropriately. The district is also responsible for managing each program, employee, and service provided, including maintaining billing documentation and ensuring that double dipping does not occur. This is the part where, what you call it, a vendor. A vendor comes in handy when you are participating in multiple programs. They will help you differentiate who goes where, what gets priced in what category, and they really help to sort all that out for you. I believe the next slide talks about the qualified practitioners. So it continues on with we have our small LEA BOP and CYBHI. These are the ones that are qualified according to DHCS and CMS to participate in these programs. Now, this is not an extensive list, but it is a good place to start. Small, you can see is separated into Pool 1 and Pool 2. Those Pool 1 direct service providers are also known as LEA BOP providers. They can participate in both, but if they're in LEA BOP, they need to be in small. And they would fall under Pool 1 as that direct service provider. And then you have administrative providers, um, like coordinators like myself would fall under that participant Pool 2. Principals, secretary staff, LEA BOP, you have the licensed physician assistants or psychologist. If you have these ones that are providing on a regular basis direct medical services, they would be billing through LEA BOP. And then you have CYBHI, where these ones were already providing services for students. However, most of what they did was not reimbursable. A lot of it now can be. We can recoup funds that were previously unallowed. But now through this new initiative, there is more money on the table basically to grab for your district. Next slide, please. All right, so what is RMTS? We've been talking about SMAW and LEA BOP, and both of those use RMTS. RMTS stands for Random Moment in Time Survey. It's a mandated online platform. When you're participating in LEA BOP and SMAW program, it's a statistical sampling methodology that estimates the amount of time spent on various tasks, be it Medi-Cal or not. The program focused on direct services, which was that pool 1, and administrative activities, which is pool 2, for students who are Medi-Cal enrolled and have a care plan, IEP, IFSP, or etc. The LEC or RMTS unit would oversee RMTS, which would include LEA BOP and SMA. Participating districts are mandated to contract with the LEC or RMTS unit. The RMTS is a randomly selected one moment in time survey. So when you get your moment, they want to know what is going on for 1 minute out of your day, and they'll tell you which minute, so you can't just pick one. It's sent to a predetermined list of participants who are determined by your district, by the coordinator or supervisor of the program. And then RMTS is mandated to receive reimbursement for LEA BOP and SMA. So if you participate in LEA BOP or SMA, you will be included in this survey process. CYBHI participants do not have to RMTS. However, if they participate in CYBHI and SMA and LEA BOP, they will need to RMTS. So you got to make sure that they're ready for that RMTS, that they're trained properly, and your LEC would help you to train them properly. Next slide, please.
Hold on 1 second.
Okay.
So I saw a couple of staff put in their chat that you are participating in all 3 fee schedules. Is anyone comfortable taking themselves off mute to talk about the RTMS survey that you have received, and just share your experience so that others that are expressing interest can, be aware that it's not a long, exhaustive, intimidating process. If someone, I don't want to put Cecilia, out, but if anyone would take themselves off mute and share their experience, I'd be overjoyed to hear.
I can speak on it if nobody wants to speak. I've been doing the RMTS in our service area for about 3 years now, and it is very tedious just trying to get all the requirements done and having to train and retrain. We do have, I think our challenges are when there's change of staffing. So we have sometimes different positions that either get promoted or they're part of pool 1 and then they have to be put in a separate pool if they change positions. We've had some staffing changes as well in our office, so we have one of our other technicians kind of helping out with that. But for the most part, we're getting better. Like our percentage and our compliance stays above 95%. But it's just not getting to that point where we don't have people that answer their moments. And I think that's where our challenge is even though we send out the reminders, we sometimes by the third and fourth, when it comes down to the last day of the survey and it's about to expire, we have to kind of reach out and do more outreach to make sure that they don't miss that because it goes against our compliance. I don't know if that makes sense, but yeah, I think that's where our biggest challenge is getting our list together of our TSPs. And so with that new change coming up where they're going to add a quarter 1 in July is going to be, I think, a big challenge for us. And I know, Elizabeth, we've been in most of the same meetings that's coming along from CMS, and with the LEC, they've also explained it to us as well. So I think that's where going to be our biggest challenge because there's just certain regulations we have to follow that's regulated by CMS and then to DHCS and then the LEC or the RMTS compliance, I guess what they're called now.
So Cecilia, when a staff receives a survey, how long does it take that staff to complete their survey?
So it's actually only three questions. Where you working, who were you or who were you with, and what were you doing? But usually we tell them it takes no more than like 2 or 3 minutes to answer. But by the time we track them down, sometimes it could take us like 2 to 3 days. And then we have to keep sending emails and make phone calls. But that's where I think our biggest challenge. If they answer it right on the dot, we move on and then we're good. It's just the ones that we've had to send second or third notices. And then when it gets down to the last one, I have to intervene and start making phone calls and reaching out to whoever our contacts are, the administrators, the secretaries, anybody who works with the people on that list.
Thank you. And Anna, I saw that you put something in the chat. I'm not sure if you want to take yourself off mute and share your experience.
Sure, no problem. Yeah, just like kind of saying, like Cecilia said, it takes less than 35 minutes. It's so easy. I don't manage the SMA in our organization, but I've received the survey and I've taken me just, yeah, 3 minutes, just quick questions. And what I like about it is that you get an email giving you a heads up that, hey, you're going to receive this RTMS survey on this day around this time. So it's nice because I know to look for it if I get that quick question. So it's really seamless. I don't, like I said, I don't manage it. So I don't see what you see, Cecilia, but as a respondent, it's very swift, easy, ready to go. And the training was very clear as well, how we did it in our organization. We had a meeting and then it was followed with quick instructions, a sample of the questions, sample of responses. So it felt very easy peasy from the respondent end.
Thank you. And Dr. Rogers, I see you putting some, I don't know if they're questions or comments in chat, but do you mind taking yourself off mute and talking to the group?
Sure. I remember when I first came, because Fontana uses it. It was very interesting when I first received it because I was not accustomed to it. And it is awkward if you've never had it and receive it. So I do think it's always good if you are going to implement it, you should make sure that people understand what it is and why you're receiving it. Because I do recall, like I said, I was new to the district and I started receiving it. And then I didn't understand why I was receiving it. So the first time I blew it off because I was like, oh, who is this? Because I'd never heard of that. and then I got a phone call later on from my supervisor saying, hey, you're supposed to complete those. And at that moment is when I realized, oh, that's why they're doing it. And this is what it's for. And I never missed one again. But it always is good to just, even if it's a regular memo to keep everyone abreast, it doesn't take that long. And then I think once people are in the habit of doing it, they're not taking it, they're not really sitting here trying to plan something through that day. It's really, what are you doing so they can get a good idea. So it was new. And then I also made sure that I told my assistant principals and any of those who work with me afterwards, you could receive this, do not freak out, just be honest. You know what I mean? It's really making sure that they get that moment of what you are really doing.
Thank you. Before we move on, does anyone else have feedback or anything they would like to add to this discussion about the surveys? No? Okay. All right, Elizabeth, I'll turn it back over to you.
Alrighty. And I will agree with you that proper training is very important. As a coordinator, that's one of your responsibilities is to train those underneath you that are participants to know that something's coming their way, because how can they be expected to complete something if they're not knowing what it is? So I agree with you there. Alrighty, so what does the LEC do? I appreciate this slide because I totally agree with it. They will train and train and train and train and train you. And then they'll train you some more. We have so many training videos available to us. The LEC is really your best friend. They are there when you need support on or questions on how to do this, vacancy, how to do open quarter, all these different things that come up for coordinators. They probably already have a training video for it that they can send you to and then also walk you through that. So they oversee the program. They help you stay in compliance so that you're receiving as much funding back as you possibly can. They monitor your progress within the programs. They will audit you periodically to make sure that your documents are all where they need to be. This way, in case DHCS audits, everything is ready to go. You're where you need to be. They will remind you and review with you and follow up with you. They are there to act as the mediator between you and DHCS, and they will stay on top of all these new changes that are coming along. And we know we have some big ones coming, like Cecilia brought out. So they are there for you. That the LEC is Rebecca and her team are wonderful for Region 10. They do a wonderful job at helping to make you feel prepared in what you're doing. They make you feel competent. And like I said, the LEC should be your best friend. So you want to make sure that you're keeping that relationship alive. And if you have questions, don't hold it to yourself. Make sure you voice those questions because you will get answers. So, next slide, please. Alrighty, so all three programs. By participating in all three, it's really a way to catch any reimbursement for services that your district provides. You would be creating kind of like a funding ecosystem that allows school districts to recoup costs for the health and wellness services that they're already providing. You're already doing these services for your students, but you're just not getting paid for it. So why not get paid for it? Together, these programs, they turn the school into a sustainable hub for student health without draining that general fund. You're allowing the district to build permanent, high quality wellness infrastructure that doesn't rely on temporary grants. You're bringing money in that is used for your district for these health and wellness programs. Yeah, so you want to make sure that if you're participating well. You want to make sure that whoever's in that position gives it at least their best. Because it is there is a steep learning curve to the position. I will admit that. But by participating in all three, you're able to catch that reimbursement that may have been lost previously. Next slide, please. And when can you join? You can join right now. Rebecca and her team will start the onboarding process as soon as you have your district support and you have employees that are qualified to participate. It brings out that onboarding can take a couple months for small and probably longer for LEA BOP, but they will do everything to get you going as soon as possible, and they will walk you through it every step of the way. So there's no chance of you being left in the lurch wondering what to do next. They will stay in contact with you. So if you can, sign up. Start participating. Get that money in for your district. You want to get those kiddos the things that they need, and the way that we do that is by getting these programs that have funding sources. Next slide, please. Alrighty, and that's it for me. Rebecca Smith, her information is at the top. And then I believe the next slide is her team. And they are there 24/7. No, they're not. But it seems like they are. They'll get back to you as soon as they can. Usually it's either the same day or within the next day. And I don't see it on here, but they also have a MAW support email. And that email, it goes to all of them. So if you can't get a hold of your technician, there's no need to worry, because you also have the MAW support line that will go to all of them. So one way or another, they're going to get your information. So, yep, that's it.
Thank you, Elizabeth. And I can say that the LEC team is very prompt. They will respond to your emails, and Karen just popped it in the chat. If you want to reach out and need a more prompt response, that's going to go to everybody that Elizabeth was speaking about. So now we're just going to open it up for any Q&A. Does anyone have questions about what they heard? Is there an invested interest in me hurrying up and connecting you to Rebecca? Or any questions in general about CYBHI fee schedule? We'll open it up for a few minutes. Are there any questions in the Google chat? No? Okay, well, I'll hang on for a few minutes. Yes, Juan, Karen, can you put the live binder in the chat? Someone's asking. There you go. There you go. So if you you can access the slides from the live binder. You're welcome. And we'll hang on for a few minutes if anyone is, has questions but don't want to really take yourself off mute and ask. But Elizabeth, if you want to hang on with us, just in case it's a more detailed question. But thank you all. Dr. Rogers, I'm going to be calling you. Oh, okay. Hi, Anna. There's some Firefly notes in here, but go ahead. You can ask your question.